yes. Checking connection. Live.
All right, then we're live. Okay, hello everybody. It's Dr. Alex Earle here, and it's Hump Day with Dr. Alex Earle. We're here at Pure Plastic Surgery, and this is the time I get to spend with you guys and go over plastic surgery topics and answer all of your questions. And today, we're going to be focusing on the tummy tuck. That's right, tummy tuck. So I'm going to talk about this for a little bit. We're going to go over as much information as I can. As the title says, everything you need to know about the tummy tuck. And then, of course, I'll be happy to answer questions regarding tummy tucks or anything else that you have in mind regarding plastic surgery. All right? All right, excellent. So let's go ahead and dive in because it's a lot of information that we got to cover. And, of course, I want to leave time for questions as well. So let's talk about the tummy tuck, right? And so when we talk about that, well, the first question is, well, who actually needs a tummy tuck, right? So I know there's a lot of patients out there. There's sometimes a little bit of confusion. People are thinking like, do I need a tummy tuck or am I okay with a lipo 360 or a BBL? Who are the patients that actually need the tummy tuck, okay? So really the main thing, or one of the main things is, do you have loose skin or skin laxity, okay? So does the skin kind of move around, wiggle around? Does it have a bunch of stretch marks? Is it poor quality skin? Is it skin that when you kind of pull it, it doesn't bounce back, it just kind of stays hanging down? Does the skin hang over the pubic area? These are all signs that you have loose skin, right? So if you have loose skin, then you're a candidate for a tummy tuck. And we'll talk into we'll get into the different types down here. But that's definitely one of the main things, right? You have to have a certain degree of loose skin. But it's not the only thing, right? Sometimes you can do a tummy tuck and the skin is not that loose, but you have something else going on, right? So one of the other things that could be happening is you have what's called a diastasis. So diastasis is when you have a muscle separation. So the muscles that come up and down through here, they're called the rectus muscles, rectus abdomini, okay? And so these muscles, sometimes with pregnancy or weight gain, they become separated and it forms a weakness in between the muscles. And that weakness is not a hernia, but it's a weakness and it's called the diastasis recti. And that, the only way to fix that is with a tummy tuck. The only way to fix it is to go in and actually stitch or suture those muscles back together again. There's no amount of sit-ups, core exercise, or anything like that that's going to make the muscles come back together. There's no exercise that can do that, okay? So the only way to fix that is the tummy tuck. Same thing with the loose skin, right? If you have loose skin because you've had one pregnancy or multiple pregnancies or you've had massive weight loss, there's no amount of exercise that's going to make that skin bounce back. The only thing you can do is remove the skin, okay? And then, of course, sometimes you do also develop muscle weakness. You can have that with or without the diastasis recti or separation. So it is possible to have weakness and not a lot of separation, or you can have both. You can have separation and weakness. So weakness typically happens after multiple pregnancies. So if you had 2, 3, 4 pregnancies, or if you've had a pregnancy of multiples, twins, triplets, okay? Those muscles can sometimes get stretched out so far that they don't really bounce back well, and so they become weak. And so when you're standing, to the side and you just kind of relax the muscles, it still looks like you're like a little bit pregnant because those muscles are not strong enough. And sometimes even with exercising, core exercises and crunches and sit-ups, they don't strengthen all the way back. And so for this indication, basically strengthening that abdominal wall and suturing or stitching those muscles together to get them tight is what needs to be done, all right? So that is who needs a tummy tuck. Of course, not everyone is a candidate. You want to be healthy, generally healthy. If you have some medical conditions like diabetes or high blood pressure or thyroid condition, these all need to be under control, right? And what's very, very important with the tummy tuck is there cannot be any nicotine in your system, all right? Nicotine can cause a lot of complications with the tummy tuck. It's one of the worst things that you can do, especially for this surgery in particular, because they can lead to basically the skin dying, what we call skin necrosis, which is a terrible, terrible complication, or also increases in infection. So definitely no nicotine for anyone that's having a tummy tuck. If you come here, your nicotine is positive, surgery is canceled. Like straight up. There's nothing else we can do. Okay? Alright, so that's who needs a tummy tuck. And if you have the loose skin and you're still wanting the Lipo 360 and the BBL, well, you guys know what I say, right? What's the Earle mantra? I held up the sign. I say it all the time. Do your tummy tuck first. Always, always, always do your tummy tuck first. Do your tummy tuck first and then come back 3 to 4 months later and do your BBL. All right? Okay. When is a good time to get your tummy tuck? Well, ideally when you're not going to have any more kids, right? Because if you do your tummy tuck and we get those muscles nice and tight and back together again and we remove all that excess skin, you get that beautiful belly, and then you get pregnant again, boom, everything's going to get stretched out. And then you're going to have another tummy tuck, all right? And we want to try to avoid that. So ideally, when you think you're done having kids, of course, life always happens, things can happen, but, when you're just like not planning on having any more kids, that's the best time to have it. And then in terms of the order of things, if you're going to get a tummy tuck and the Lipo 360, or a tummy tuck and a BBL, then I always recommend, like I just said, doing your tummy tuck first, whether it's by itself or part of a mommy makeover, but do that first, and then 3 to 4 months later, come back and do your Lipo 360 or BBL. All right? Now, there are many different types of tummy tuck, and so we have to do an evaluation to determine what is going to be the best type of tummy tuck for you. So there's your mini tummy tuck, your regular or full tummy tuck, extended tummy tuck, fleur-de-lis tummy tuck, and your reverse tummy tuck. Okay? All right, let's go through each of these here real quick. So mini tummy tuck. Well, everyone's like, well, doc, I never really want a tummy tuck in the first place. Can you just give me a mini tummy tuck? Right? Well, the thing is that there's very few people that are a good candidate for a mini tummy tuck. Why is that? So what does it mean that it's mini? It means that not so much that the incision is shorter. It means that we're doing less. We're not doing the muscle repair. So we're not doing the plication. And we're not doing what's called the umbilical transposition, or moving the belly button. So when you have a mini tummy tuck, all we are doing, it's actually a very simple, straightforward procedure. All we are doing is removing a little bit of excess skin in that lower belly area between the belly button and the pubic area. That's it. That's all that's being done. The incision is actually not that small. It's typically still longer than your C-section scar. It's still going to go from about hip bone to hip bone. It usually doesn't go like around the corner, but it's still going to go from about hip bone to hip bone with the mini tummy tuck. So what's mini about it is not so much the incision, it's that you're doing a lot less. You're not doing the muscle plication, you're not doing the umbilical transposition, just removing a little bit of that excess skin. And the dissection only goes up to the belly button. You're not dissecting all the way up. Okay? Very few people are candidates for that, because most people have loose skin below and above the belly button, and they have either muscle weakness or muscle separation, in which case then you become a candidate for your regular or full tummy tuck. So now that's a bigger surgery that involves removing all the excess skin, doing your muscle plication, bringing those muscles back together again, strengthening that abdominal wall, and then we have to create a new opening for that belly button to come out, what we call the umbilical transposition. So there is going to be a small scar around the belly button as well. And the incision will go certainly from hip to hip, sometimes a little bit around the hip bone up here. And that's your regular tummy tuck. And that's what most people are a candidate for. Most people are a candidate for that. Extended tummy tuck, that's usually for massive weight loss patients. And that just means that the tummy tuck doesn't end right here, but it goes around the corner and starts going towards the back. And that's your extended tummy tuck, okay? But you're still doing the muscle plication, you're still doing the umbilical transposition, all right? And then you have your fleur-de-lis. Again, these are for like the massive weight loss patients, right? Those that are lose like 100 pounds. And so then they don't have only loose skin in this direction, but they have loose skin in this direction. The skin is loose in two directions, okay? In the vertical direction and in the horizontal direction. And so in that case, you want to you're gonna be doing a fleur-de-lis. The scar pattern ends up being like the one for your regular tummy tuck here, but there's also a scar that goes up and down, all the way up and down the belly area too. That's why it's not so popular as well, because it does involve that big scar right across up and down the belly. Most people don't want that unless they have so much loose skin that they're really just going to benefit quite a bit from that, and they're okay and they tolerate that scar. All right, but also less popular because of that. And then last but not least is your reverse tummy tuck. Reverse tummy tuck, we see it actually a lot more often in people that have had prior lipo. So sometimes you had a little bit of loose skin and then you had liposuction. Unfortunately, sometimes the skin becomes more loose, and typically it becomes loose above the belly button and not so much below the belly button. And so now you have some loose skin above the belly button, and so your regular tummy tucks and minis are not going to do anything for you. You got to go the other way. So you're going up. You're going up instead of down. And so you're removing some excess skin in the upper part of the abdomen, just underneath the breast. You're able to hide that incision underneath the breast in that breast crease area, similar to like if you're doing a breast lift. It's in that same spot. So you hide the incision up there, you pull everything up, and you tighten up the upper abdomen. You don't do any muscle repair with that. Okay? When you're doing your reverse tummy tuck, listen carefully. There's no muscle repair with a reverse tummy tuck, okay? No muscle repair, and you're not moving the belly button. So there's no scar around the belly button, just a scar up underneath the breast, okay? So those are the different types. Of course, in order to determine what's the best type for you, we got to do an evaluation. So the best way to do that is you go to our website, www.pureplasticsurgery.com. You send in you hit the virtual consultation button or the get started, with your journey button. Yeah. And then you fill out your questionnaire and you send us your photos, all right? Talking about that, have you guys checked out the new website? It is awesome. It is fantastic. I'm like super, super happy with it. It's so sleek. It has all the technological bells and whistles, and you gotta go and check out our gallery. Check out our before and afters, which is like you've never seen any gallery like this. It's absolutely outstanding. So I highly recommend all of you to go to our new website, www.pureplasticsurgery.com. All right? All right, great. So you come in for your procedure. We've done all your pre-op work. We've checked your labs. We make sure you're healthy.
So you can show them
the site?
Yeah, where they should press, start your journey.
Yeah, so we can do that. It's kind of loading a little bit slow here, but definitely if you hit the start your journey button, that's where you can submit your information. And then our patient care coordinators will take it from there. Our patient care coordinators are bilingual, inglés y español, ¿ok? Así que pueden apretar ese botón y mandan su información y se van a comunicar con una de nuestras coordinadoras que todas son bilingües. They all speak English and Spanish, all right? So, check out the website and send us your information, all right? Awesome. So, all right, so you've had your procedure. We've had procedure day. The tummy tuck does require drains. Typically 2 drains, little tubes that come out the sides there. And how long those drains are in really depends on the patient. Every patient's a little bit different. Some patients, the drains can be in longer than others. What's the average? The first drain usually in for about 7 days, and the second one comes out usually around day 10 or so. But again, that's just an average. Every patient is a little bit different, okay? You are gonna feel tight, and so initially you're gonna be walking a bit hunched over like this. And you're going to want to sleep in either a recliner, or if you're in the bed with a few pillows behind your back and a cup underneath the knees to relieve some of the tension in that belly area, okay? I don't say that it's absolutely necessary, but some patients like to have a walker after a tummy tuck. They say it helps them, move around, and they have less lower back pain because of that, okay? But again, I don't know that it's absolutely necessary. But things that make your life easier, I think a recliner makes your life easier, and I think the walker will make your life easier as well, okay? So, post-op care, initially, while the drains are in place, you're gonna have an abdominal binder, kind of this white thing that wraps around you, gives you some support. Remember, the binder's there just to give you some support. It's not to be taken like a waist trainer. You're not supposed to crank it all the way down, okay? We just did this big surgery on you. We have an incision that needs to heal. It needs blood flow, okay? If you crank that binder so tight that there's no blood flow, we're gonna run into problems. The incision's gonna open or the skin's gonna die. So don't do the binder too tight, okay? All right, but you will have that binder until the drains are out. Once both drains come out, then you can switch to your faja. All right, so you start with the binder. Once the drains are out, then you switch to your faja. Faja, you're going to use the first 6 weeks, night and day, and then an additional 6 weeks, at least 12 hours a day. Okay? Drains we just talked about, there's 2 of them. We'll teach you how to empty them and all that. And for the out-of-town patients, don't worry so much about these drains, okay? You don't need like a specialized person out there, like a nurse or a doctor. You just need someone who's willing to help you. And our nurses here will walk them through how to remove that drain. Super simple, very easy process. Do not worry about this whatsoever, okay? All right, do I recommend massage for tummy tuck? Yes, I do. I recommend at least 10. Initially, they're going to be focusing mostly on the flanks and the sides. That's where we do our liposuction. And on the lower back to relieve some of the tension in those muscles back there, okay? After about 2 weeks, they can start doing some massage in the front as well. But we want to give about a 2-week initial healing time for that front massage, okay? Very important, belly button care. Listen to this. After your tummy tuck, you want to take care of this belly button. Initially, you're going to clean it. You're going to clean the deeper areas with a Q-tip and hydrogen peroxide. So you dip the Q-tip, in the hydrogen peroxide. You put it in there. You clean the deeper part of the belly button. That's going to help remove any blood that might be in there, any crusties, really clean it out. And then after you do that, you're going to take your antibiotic ointment, the mupirocin, and you're going to apply that around the incision. All right, and you're going to do this every day for the first 5 to 7 days. Okay? All right, and that's your belly button care, and that's typically what's the most important. But actually, there's a couple of things that I didn't write down here that are super, super important. Number one, of course, you want to stay hydrated. But the most important thing that you can do is walking. Why? Who knows? Because we want to prevent...
Tick-tock. Yeah.
We want to prevent potentially the most serious complication after a tummy tuck. We want to prevent blood clots. DVTs, which are the blood clots in the legs, deep vein thrombosis, or PEs, the blood clots in the lungs, pulmonary embolus. So walking is super important. You got to be up and walking at least 10 minutes every hour while awake. I also provide all of my patients with a device that goes around the legs called the Vena Pro, which is a sequential compression device, which keeps the circulation moving. And I give this to 100% of my patients. So you're going to use that device for the first 2 weeks, again, to decrease the risk of blood clots. And if, for whatever reason, I feel that you need something additional to that, sometimes I also give an injection called Lovenox, which is an injection that also helps decrease the risk of blood clots, okay? So, lots of things that we do to help decrease the potential most serious complication after this surgery, which is a blood clot, a DVT, or a PE, right? So whenever we talk about surgery, we do have to talk about complications. The only way to have a 0 complication rate is what? Is to not do surgery at all, right? It's like the only way to have a 0% chance you're gonna crash your car is to not drive. Same thing right here. In fact, the complication rate of any cosmetic surgery is much, much less than you crashing your car out there. Okay, just so you know that, by the way. All right, so what are the potential complications? Well, of course, bleeding is always a possibility, although the rate of that is extremely low. The one that we worry about the most are the blood clots that you just talked about, so we do quite a few things to minimize that risk. We use your walking, your Vena Pro, and plus minus the injections if you need those, okay? Infection, always a possibility, so we do give you antibiotics during and after surgery to minimize that risk, okay? Wound breakdown is when the wound opens up. Sometimes that can happen, especially if you're not compliant, right? If you're doing too much, or if you stand up too soon or too quickly, right? So we want to avoid any strenuous activity and no heavy lifting for the first 6 weeks. No strenuous activity, no heavy lifting for the first 6 weeks. Otherwise, you could potentially, that could lead to some wound breakdown, or on the inside, it can mess with your muscle plication. If the stitches that we put in there, they can pop, and then that plication, boom, it's done. There's nothing that, basically, there's nothing that we can do. So be very careful. First 6 weeks, no heavy lifting, not much more than 10 or 15 pounds. and no strenuous activity. Okay? Scarring, we always have to, think about potential for keloids or hypertrophic scars. So starting at 2 weeks post-op, we're going to use a silicone-based cream called Silogen to try to minimize that risk. It's not unusual a lot of times to get scarring around the belly button, so I have to be very, very on top of that. I do my very best to put the incision for the belly button as kind of deep, as inside as possible, so it's not very, very visible. A lot of times I say the tummy tuck is all about the belly button, right? So I spend a lot of time being very meticulous with those belly buttons, making them look as natural as possible, making sure that incision is kind of as inside as possible and the least visible as possible, all right? And it's a beautiful technique. If you haven't seen my technique, check it out. What can you do? Go to the website, right? Go to our gallery. It's a kick-ass gallery. You should definitely go there, okay? All right. Seroma is fluid buildup. That's why we do the drains, and we don't want to remove the drains too soon. If we remove the drains too soon, then the risk of seroma goes up. That's fluid that accumulates underneath the skin there. And if you have a seroma, I mean, it's not a big deal. It's just annoying, but you have to go in with a needle and, basically suck it out. Do what's called a needle aspiration, okay? And then last, dog ears. That's sometimes where there's a little bit of excess skin left on the corners there. We try to avoid that as much as we can. It's a little bit of a battle between the dog ear and how far you need to extend the incision. But yeah, the more you extend the incision, the less risk of dog ears, and also doing liposuction to that area helps reduce the risk of the dog ear. So we do our best to try to reduce that risk as much as we can. Sometimes you may still be left with a little dog ear. If that happens, you can come back and it can be fixed very simply under local anesthesia. It's like a quick, just in and out, 15-minute procedure where you can, we're just using local anesthesia. You can just drive yourself in, drive yourself out. It's not a big deal. Okay? All right. Whew. That was a lot of talking. But I think it's pretty comprehensive, but I'm sure there's always questions, so I'm happy to answer that right now.
Okay, I have a lot, and let's start on TikTok.
Yes. TikTok, what's up?
Yeah, 1,800 likes. That's a lot.
Nice. Love it.
Adri,
Thank you.
I'm new here. The extra skin in arms can be done?
Definitely. So that's what's called a brachioplasty or arm lift. So again, a lot of times with weight loss or massive weight loss, you get left with that kind of flappy skin here. And so that can be removed surgically. If it's moderate to severe amount of excess skin, then I recommend the surgical removal, which is that brachioplasty or the arm lift. The upside is that all that skin gets removed, you get that nice tight arm again. The downside is that there is a scar that typically goes from the elbow area to the armpit area. I like to put it right into here so that when your arm is down, it's not visible. But if you were to raise your arm up, you could see it, all right? Now, if you have just a mild to maybe low, moderate loose skin, then sometimes we can tighten it up without having to do that surgery. We can use what's called body tight, which uses a radio frequency energy or the Vaser to help the skin retract without having to do the surgery in the big scar.
Okay. Can you please explain why you don't perform a BBL and Lipo 360 at the same time?
No.
So she's confused.
Yeah. So let's clarify that point. So I definitely do Lipo 360 and BBL at the same time. So actually, Lipo 360 is part of your BBL procedure, right? That's how we contour the body. It's actually, I would call it, to be more specific, I would call it liposculpture, because I'm not just removing fat, I'm sculpting the body when I do that. So it's a liposculpture 360, which you can add some high definition if you're a good candidate for that and if you wish to do so. And then, of course, some of that fat that we remove is the same fat that we then use to add to the hips and the buttock for the BBL portion of the procedure or the fat transfer portion of the procedure. So that's the that combination is basically happens all the time by definition when you're doing a BBL. What I don't like to combine is a tummy tuck and a BBL, and that includes the Lipo 360. So I don't combine tummy tuck and Lipo 360 alone, and I don't combine tummy tuck Lipo 360 with fat transfer, which we call a BBL. That's what I don't combine.
I need a breast reduction and lift.
Yes. Now that we combine. Every breast reduction gets a lift by definition. There shouldn't be any instance where you're doing a breast reduction and not lifting the breast. Okay, so that's going to be done together. So at the same time, we are removing all the excess breast tissue and the excess skin, and we're lifting up the breast so the nipple position comes back up to where it's supposed to be, and we use and rearrange your own tissues to give you a little bit more fullness in that upper pole of the breast. And that's all done together with your breast reduction and lift.
YouTube, what are your
Yeah.
thoughts about doing a second tummy tuck?
So it can happen, right? So that's great. We've got questions from all our accounts here today. That's
We're
awesome.
on fire.
Yeah. So thank you, everybody. And what about a second tummy tuck? Yeah, it can happen. So what's the most common? The most common I've seen it where someone gets a tummy tuck and then they become pregnant again, right? So you do your tummy tuck and then you become pregnant again, and so then now things got all stretched out again, so you need to come back for a secondary tummy tuck. That's the most common. Sometimes I've seen it where simply the first tummy tuck, whoever did it, just wasn't aggressive enough, as you will, and there's still loose skin. So I've seen that as well. And then the third kind of patient that I've seen is someone who had a tummy tuck and then gained weight and then lost weight again. And so we see that. So definitely you can do a second tummy tuck. And in that tummy tuck, it can be mini, if it's just the bottom maybe, or it can be regular where we just do the whole thing all over again and do the muscle repair all over again as well.
BBL before or after babies?
Okay, so BBL before or after babies? That's a good question, and it can be done either way. So it's a little bit, so as opposed to the tummy tuck, where I'm like, you know what, you should really do it after you're done having babies, right? Because you're gonna stretch everything out and everything else. Now, the BBL, I've done it, I've had patients where they've had their BBL and then they have pregnant, they have the baby, and then their body like just bounces back and they still have that shape. Not all the time, but a lot of the times I've seen this happen. So it's okay to have your BBL before babies. It's definitely not going to affect the pregnancy in any way. If you kind of control yourself during your pregnancy, right? You don't go like all out, just eating and gaining weight and stuff like that. Like if you have like a healthy pregnancy where you're eating what you need to eat to feed yourself and the baby, but you're still exercising and moving around, then a lot of times after you have the baby, the body bounces back.
Hi, I have a question. I did a BBL with you and recently got in an accident where I lost muscle atrophy.
Oh no.
Will I get the volume again?
So I think that the first thing that I would recommend is some physical therapy, right? So it seems like you got in an accident, you weren't able to move around a lot, and so when that happens, the muscle tends to shrink down, which is what that means, muscle atrophy. So the first thing to try to attempt to do is to build up the muscle again, right? And so in order to do that, you have to get into physical therapy and start doing exercises that are going to build up that muscle. If it's the gluteal muscle that we're talking about, then squats are the best thing that you can do. Start doing squats, start building that muscle again. Now, sometimes it is true when it atrophies and you build it back up, it may not come back to what it used to be, and you're still feeling like you lack a little bit of volume. So then in that case, then we can take a look, evaluate everything, and determine whether another BBL will be helpful just to give you some more volume at that time.
Hey, I'm curious about the recovery time for a breast lift and augmentation. Breast lift / augmentation.
Yeah, so breast lift augmentation or breast lift with implant is a very common procedure that we do as well. We probably do that every single day here. And that procedure, in terms of recovery, it is 6 weeks in terms of no heavy lifting or strenuous activity. But in terms of most daily things, like going back to an office type setting, driving, usually you can do that within a week. So you don't have to take off that much time in order to recover, as long as you're not doing the heavy lifting or strenuous activity, okay? So that's important there. So if you have a job that's more active, like firefighter, sometimes nurses or a police officer, then yes, you may want to take off, a few more weeks. But if you have an office type setting, usually after about a week, you can go back to that. All right. Well, no, it has been 30 minutes already.
Trust me.
Really?
Well, we can go with another one. Yes,
All
let's do
right.
one more. One
Wow.
more. One more. You said.
This time, like, they blew away. Let's do. Let's see. Let's do 5 more questions today.
Okay, I have more than that, but it's fine.
All
Do
right. All right.
you revise belly button from previous tummy tucks?
Definitely, yes. I'm gonna admit, back in the day, I've been getting better with my belly buttons, every day, every year. Now I think they're like beautiful, and so it's rare that I have to revise my own belly button now. But I have revised my own and others' belly buttons from the past, and it again, an evaluation is what we need because it determines how complex is going to be the belly button revision. If it's just a scar issue, sometimes it can be very simple. We just inject some local anesthetic, remove the scar, put it back together again, and you're good to go. But sometimes if it's still kind of poking out or some other issues going on, sometimes we got to do it from the inside again. Like we got to open up the tummy tuck incision, dissect up to the belly button, like make it more of an innie and kind of just do it all over again from the inside. So it does require an evaluation there.
Do you add fat to the thighs to help sculpt the body?
To the thighs, yes. Well, let me caveat, not like the entire thigh, okay? But if I feel like I need a little bit of fat, like especially in this area, as I want to transition from that hip down to the lateral thigh, and I want to try to make that transition as smooth as possible, then yeah, I'll add a little fat there to kind of feather it in, excuse me, to create nice, smooth transitions. So for that purpose, yes. But for the purpose of just making a bigger thigh in general, no, I typically don't do that.
Do you do reverse tummy tucks for loose skin below the breast?
Yeah, so that's exactly what we use it for. So that's our reverse tummy tuck here. So when you have loose skin below the breast, but around the belly button, below the belly button, everything's looking okay, and we just need to kind of tighten that up. That's when we're going to do that reverse tummy tuck. We're going to remove the excess skin. We're going to pull things up. And then we're going to hide that in that incision in that inframammary fold just below the breast.
When, after a BBL, can you start wearing tight clothing?
So you can start, okay, first of all, how about your faja, right? You're going to be wearing your faja the first 6 weeks, night and day. And then after that, you're going to scale down to 12 hours a day, but you're going to be wearing your faja for 12 hours a day for an additional 6 weeks, okay? So that's the first basically 3 months, 6 weeks, night and day, and then 6 weeks, 12 hours a day. During that time, you can wear some, like leggings and stuff like that. But what I don't want you to wear is like tight clothing, especially jeans that have like seams that may cause permanent indentations in your body. That's what you want to avoid. So typically for like tight jeans, you're gonna wait about 3 months.
Is it safe to get surgery again after 3 months, or are there any risk and become safety?
Yeah, so it is safe to get surgery again after 3 months. It is safe to undergo general anesthesia again after 3 months. And so when we're doing some of these combinations, like I said, say you're doing a tummy tuck and then a BBL, then yeah, I recommend doing your tummy tuck first, and then you can come back about 3 months later and do your BBL. And so that's when it becomes safe again. I wouldn't do it before the 3 months, but at 3 months or after 3 months, then it's okay to have your second surgery. Now, the one surgery that I don't recommend repeating, within 3 months is if you're doing the same surgery again. Say, for example, you did a BBL and you're thinking you want a round 2 BBL, so the same surgery again. For that, you want to wait a minimum of 9 months. Okay?
And, well, this is similar. When can you start working out after a BBL?
And you're going to start working out at 6 weeks, okay? So no strenuous activity, no heavy lifting for the first 6 weeks. But at 6 weeks, hey, that's when life becomes good again. You can start working out, you can start swimming, and you can start sitting directly in the buttock at the 6 week mark. All right? Okay, everybody. Well, now that's it. You had your bonus round. So we're done for today. It has been a great session. Thank you all for contributing and asking your questions. And I look forward to seeing you all next week on Hump Day with Dr. Alex Earle. I'll see you all then.